Nobody. Yeah. Management too is not in there, and that's a major thing in there.
What is one to do in the incident of an accident? Here you are going through doing your own thing when wham, whether it be a car accident, a slip or fall, or just twisting the wrong way. Now you have no feeling in your feet, your legs don't want to move, then within an instant the adrenaline kicks in and you jump to your feet. You ask yourself, what just happened? Why do my feet feel weird? Then you realize what has happened to you, and then the reality sets in that something traumatic just happened to your spine. There's a very fine line between paraplegic and normality. Hi, my name is John Bridgman, and I'm going to share with you my very own experience of an extremely harrowing incident that led me to undergo one of the scariest and most traumatic events in my life. It was a normal day raising walls on the job site when I requested assistance from several people to assist me placing a massive wall, only to be denied the assistance. 2 or 3 men granted me their help, and we lifted the wall and started to move it into the position in which it belonged. As I was holding the top of the wall, which weighed at least 3 times the weight of the other side, we began to move into position. The next thing I know, I was sitting on the ground, unable to move. As I sat there with at least 700 pounds sitting on top of my legs, I continuously yelled for other guys to remove the wall from atop me. Once they finally realized the importance of the situation, 6 people came over and removed the massive wall from my legs. Once free from the extreme pressure of the wall, I laid there for what felt to be several minutes. As I lay there unable to move, all I could see was my family standing around me. Then after about 15 minutes, I jumped to my feet and ran back to work as that is how we did it on a job site. Close to an hour later, the adrenaline wore off and the reality of the pain set in, at which point I left the site to seek a doctor. After months of twisting, pushing, and extreme amounts of pain, they finally started to discuss the option of surgery, at which point I fell apart. What about my family? I had 2.5-year-old twins at home to care for. That was when all of the thoughts/questions started to hit me. One of the first things that ever crossed my mind was, will I get to see my beautiful daughters grow up? Will I actually be able to be an influential part of their lives? I guess it was at that time I allowed my disposition to get the best of me, and I began to fall into what I considered my Great Depression. Spinal fusion surgery, that was the conclusion. Being put under sedation for several hours, having foreign items placed inside my body, chances of not waking up, or even worse, not being able to walk. Those were the thoughts that wormed throughout my mind. Will it be worth it? What will it be like having such an invasive surgery? How will my quality of life be after such a long, life-altering surgery? I found a paper online that helped sum up a lot of my thoughts, written by Lavon M. Johns, that said, you may ask yourself, but spine surgery, isn't there another way? Something else that might work? Anything but surgery? After all, you have heard about so many people who were worse after surgery, and you can't imagine being worse than you are right now. Like so many patients, you are simply sick and tired of being sick and tired. Maybe you have seen many doctors and are worn out from examinations and tests, for sure. Maybe you're beginning to feel more like a mental patient than a patient with a physical problem. After many hours of discussion with my wife, we decided that the surgery was the only option, which I am most certain that she would soon regret. They had me on my feet the day following my surgery, walking the halls of the hospital. My wife soon learned the massive responsibility of caring for someone post-surgery. As I worked as hard as I could to be independent, she was thrown into total care of me. After a week or two of my disability to care for disability to care for myself, she was able to resume her normal life. It was at this point that I believed that I gave up on being able to live a normal life. It is hard to imagine the loss of everyday functions, which include using the bathroom and also the ability to walk anywhere you want. The humility of having to have someone else clean you after you use the bathroom is beyond humiliating and hard to ask. So the question is that if choosing the option of surgery really worth it? After 3 years of feeling sorry for myself and letting my disposition ruin my life, I have finally learned that having spinal fusion surgery was the smartest thing I could have done. Even though I still suffer with extreme pain on a daily basis, I feel that life can be just as wonderful now as it has been before. Well, after many years of consideration and more pain than any person should ever know, yes, it was worth it if you were willing to put 200% towards. Here it is 3.5 years later, and I am just now seeing that I really do have a chance at a normal life. I am now working out with about half the weight that I was before my surgery, and I will no longer accept that I cannot do something. I have learned throughout my life that no matter how hard life gets, the only person that can make it better is the person living it. According to Dennis Crandall, MD, years ago, spinal surgery developed a well-deserved reputation for causing as much pain as it helped. Rarely did surgery deliver as much benefits as it hoped. Over the past 20 years of his career, advances in our ability to disguise and treat spinal disease have expanded dramatically. With the latest techniques, we are now able to get people back to work and back to life after spinal surgery, very reliably. Without these advances, I would not be able to return to school and earn my degree, let alone be trained in a new line of work. He also continued with we studied 255 patients, all adults between 19 and 60, who were working full-time prior to their lumbar surgery. Some had to stop working before surgery due to pain, but they had the compatibility to work and hope to get back to work following surgery. Return to work depends on surgery. Looking specifically at long-term work for those 255 patients, 95% of those undergoing lumbar discectomy were still working 4 years later. For patients requiring laminectomy for spinal stenosis or nerve compression as a result of arthritis, 81% were still working 4 years after surgery. Interestingly enough, of the 124 patients undergoing a short fusion, namely a fusion of 1 or 2 levels to control an unstable segment or something similar, 90% were still working full-time 4 years after surgery. For patients with spinal deformality who required long fusions of many levels in the spine, 80% were still working full-time 4 years after surgery. I can personally attest that by my 4-year mark, I will be as close to normal as possible. Here it is 3 years after my surgery, and I'm finally able to work out at the gym and play a little more with my wonderful daughters in the yard. The more time I spend in the gym, the more I find myself being able to bend and flex my spine. It is starting to look clearer and clearer to me. The procedure was a success. It just took a little longer than expected. Also stated in Levon M. John's paper was a story that I could relate to oh so much. When I walked, sort of crawled, into the spine center, I had no life efforts to continue a normal routine until the time that my back started to bother me. I was a normal, healthy, active person. Several weeks following an initial examination and MRI, I went in for a surgical evaluation. There I learned the true severity of my problem. I was told that without spine surgery, my condition would only worsen. At home, I mulled over my two options: live like this or worse forever, or take a chance to restore my life to normal. I decided on surgery. After reading this, it reminded me of the pain, thoughts, and fears that I had felt before and after my own surgery. Then it also made me think of how I feel now. Only a few months ago did I really bring myself back together and start working towards a better life. Another statement in the paper that seemed to touch was, regardless of how good I feel, I understand my limitations. Even if I don't feel limited. For me, it's a small price to pay. I'm a success story only because of my fine surgeons. Not only because of my fine surgeons, but also because I made a commitment to heal afterwards and to make positive, life-changing decisions to keep my spine healthy for the rest of my life. This is the kind of story that I want, and I will have now that I've accepted my limitations and expectations. The harder you push to accomplish your goals, the better the outcome is. Through hard work and extreme patience, you can have a normal life after a tragic accident like mine. Now in the case the procedure is a failure, you don't get complete relief. There is yet another option you can choose. It is called a spinal cord stimulator, or SCS for short, which is similar to a TENS unit but attached to your spine. The American Association of Neurological Surgeons, or AANS for short, describes it as chronic pain is a long-standing pain that persists beyond the usual recovery period, or that accompanies a chronic health condition. Because the pain is not protective and it is not a result of an ongoing injury, it is referred to as a pathological and is therefore treated as a condition, not as a symptom. Chronic pain may prevent people from working, eating properly, participating in physical activity, or enjoying life. Spinal cord stimulation is a pain relief technique that delivers a low voltage electrical current continuously to the spinal cord to block the sensation of pain. SCS is the most commonly used implantable neurostimulation technology for measurement of pain syndromes. As many as 50,000 neurostimulators are implanted worldwide every year. SCS is a widely accepted FDA-approved medical treatment for chronic pain of the trunk and limbs, back, legs, arms. With the outcome of several studies, their conclusion was, although the exact mechanisms of its actions are not fully understood, there is evidence that the SCS is beneficial in the treatment of several pain syndromes and fairly consistent results. One study reported that an estimated 60% of people who received the SCS experienced pain reduction or relief when surveyed 1 to 2 years post-procedure. In patients with FBSS, failed back surgery syndrome, clinical studies have shown good outcome when the following criteria is present. 1, treatment is initiated early, within 0 to 3 years, after first failed back surgery. 2, predominance of neuropathic leg pain. And 3, absence of psychological conditions such as depression. After not having the results I was hoping for with my own surgery, I chose to try the SCS and have had great results. When my pain levels start to escalate to a point I cannot handle, all I have to do is grab my remote, turn the power up, and I'm good to go. After a few minutes, the pain levels return to a tolerable level. With SCS, a small implanted pulse generator and thin wires known as leads are placed into the body to manage your pain. The leads deliver tiny pulses to the nerves and make pain signals traveling to the brain It's a typo. Some patients say SCS feels like a gentle tingling or fluttering sensation that replaces the pain. The medical term for this is paresthesia, but the feeling is different for everyone, and people differ in the amount of pain relief they receive with SCS therapy. In conclusion, I feel that back surgery was a great choice in my personal situation, and I hope that I was able to show you enough information about the new technologies in spinal surgery to help you make an informed decision if you are put into this kind of position, heaven forbid. Even though I still suffer with extreme pain on a daily basis, I feel that life can be just as wonderful now. Life can be just as wonderful now as it has been. Yes, it is worth it if you are willing to put forth 200%. No matter how hard life gets and how much pain it causes you, don't ever give up. If you want to live a good life, you have to push through any and everything life tries to throw at you. Always remember that it could always be worse. I want to thank everyone for being here, and I wish everyone a very happy and healthy life. Thank you.